We are back on MorningLine. Thanks for joining us on this Tuesday. With me is Dr. Stephen Patrick. He's over at Vanderbilt, a neonatologist, a pediatrician, assistant professor, and he's good to join us this morning talking about babies born dependent on opioids. It's an aspect of this whole opioid crisis that I think gets attention. I don't know, as comparison to all of these overdose stories that we've been doing in the news lately. I mean, do you have instances, okay, a baby, an infant is going to overdose if the mother carrying the child overdoses and dies? They're both going to die, right? That's right. So what's good for mom is what's good for baby. Right. And so that's why it's important that we have moms that are able to get treatment because we know, again, that's what's good for mom is what's good for baby. All right, I'm just curious, again, how do you come about seeing them? How do they get to you? Because I'm just thinking the moms out there doing these opioids are not the ones I suspect are going to be like, oh, I've got to go get my prenatal care. I mean, how do they get referred to you, or how do you find them? So a couple of different ways. First off, at Vanderbilt, we have a clinic specifically for pregnant women with opioid use disorder, so that they can get treatment. So they know there's a place to go, but do they come willingly, or are they referred? Both. So we know that pregnancy is a time where people are making life changes. If we look at drug use patterns for pregnant women compared to the general population, pregnant women are much less likely to use illegal substances. It's a time where people cut back, they try to do things differently, and so, you know, people do seek out treatment. Okay, so do they ever get referred to you by the courts? You know, again, I'm not an obstetrician. I take care of the babies afterwards. Okay, that's right. It's after the case. All right, I wanted to ask you just about the damage that the child. You said it's not always permanent necessarily. I mean, you have these things out there right now in the media or whatever. The reports were that, you know, these children born addicted oftentimes have learning disabilities later. True or not true? Not true. There is a fair amount that we lack in terms of research for long-term follow-up. Okay, then if you would, what basically does the opioid do to an infant's developing brain? Sure. It's born with this. This is a brain at the stage that is most important. Everything's new. It's growing super fast. And then you've got this substance that's nasty for your body going through this child's brain. What does that do? Well, first we have the drug withdrawal syndrome that the infant goes through. And that's at the beginning of life. Those first few weeks to months, the baby can have drug withdrawal. When we look at some long-term follow-up studies, some of the things that they suggest are maybe some issues with attention, maybe some subtle issues with IQ and speech. There isn't a suggestion that there's a long-term substantial difficulty. And we should have some pause when we think about making big conclusions without research. It was about 20 years ago that there was a big concern about a lost generation due to cocaine use in pregnancy. That really bore out to not be true to a large degree. And so what we should be doing is focusing on how do we plug in infants to early intervention services like speech therapy and physical therapy. How do we provide them the resources to develop the best that they can? And as a state, you know, we need to be comprehensive in terms of primary prevention. How do we prevent opioid use and opioid use disorder before it begins? How do we improve access to treatment? So we really need to have a comprehensive approach to create healthy moms and healthy babies. Now, I'm just wondering too, we're talking about opioids here, and obviously that's a crisis in this country right now, but is it any worse for a child to be having a mother on opioids as opposed to a mother who's having a whiskey every night? It's much worse. The whiskey is much worse. So we know, for example, so alcohol syndrome. Really? Absolutely. So alcohol is even worse than opioid. Yep. There is no question about that. While there are some, there's a lot of substances we don't know a lot about. We know a lot about alcohol. Alcohol is the #1 preventable cause of developmental delay in children, and we know that still about 1 in 10 women still use alcohol today in pregnancy. And so this is in part why, when we think about substance use in pregnancy, we need to have a comprehensive approach that include all substances, not just the substance of the day. We're talking about opioids, and you deal with it all, but I think it's real important to point that out. And it's, I didn't realize it's much worse. I knew it was very bad, but you know, the alcohol issue is, and that's something way easier to obtain than opioids. Absolutely right. You know, and that causes. Is it on par with the number of opioid babies you see? Alcohol? It's hard to know, and it's a much harder diagnosis. You know, one of the things that we know is the Substance Use and Mental Health Administration estimates there are around 440,000 infants born each year exposed to illicit substances or alcohol. Of around 4 million births. We only detect about 5% at the time of birth. Wow. And in part that's because not all substances have a drug withdrawal syndrome like opioids. And so it can be really hard to detect substance use of pregnancy. And we have to rely on things like some urine drug screens, but some of those screening tools that we were talking about at the beginning, which are imperfect. Now I don't mean to go too far afield here, but it just made me start thinking, when you mentioned that about alcohol, and I think that's important for people to know how serious the problem that is. I'm just curious if I can throw a couple other substances at you.
Sure.
Marijuana.
A lot that we don't know about marijuana.
Okay, it's unknown. It's not, okay, so I assume it's not good, like smoking anything or ingesting anything different, and of course it's illegal here in Tennessee, but marijuana, do we know? Have we seen babies born with marijuana syndrome?
Well, I certainly see a lot of babies that are born that are exposed to marijuana in pregnancy. What that does is unclear. There's not a clear withdrawal syndrome afterwards. I think one thing to know is that what we should be doing is minimizing not just illicit drugs like marijuana or opioids, but also some legal drugs. We've seen an uptick in things like various medicines, everything from seizure medicines to atypical antipsychotic use in pregnancy. While what we need to do is make sure that we do what's necessary to treat mom, keep mom healthy, but if we can minimize the amount of substances, both legal and illegal, in pregnancy, that's going to create the healthiest baby going forward.
Sure.
Still treating the mom as best we can, but we've seen today we use about 60% more medications in pregnancy than we did 30 years ago.
Interesting.
And so it's not just, it's all substances that we need to be thinking about.
What about caffeine?
In the literature, there are some caffeine withdrawal syndromes that have been described. It's unclear, and I know that certainly talk to your obstetrician about the amount of coffee intake that you take.
I know,
but as far as for the baby in terms of withdrawal, I've seen babies where mom took drank a fair amount of Monster drinks and things like that right before birth, and there was a withdrawal syndrome. Still, typically, it's mostly opioids that cause a withdrawal syndrome.
Okay, and methamphetamine.
Yeah, same thing. I mean, we see different exposures have babies have weird behavior sometimes, weird kind of movements and things like that. That's true with methamphetamine, and so you can see some abnormal behaviors at the time of birth. It's a little less unclear, a little less clear long term what some of those complications are concerning for methamphetamine.
Okay, all right. Well, sorry about hitting you with all those lists, but I think it's very, very interesting to me. I thought, and I didn't realize. I knew alcohol was bad. I didn't realize it's worse than opioid in terms of some of the effects on the infant.
A lot that we don't know about opioids, a ton we know about alcohol.
Good point. All right, let's go to Brian. Brian, good morning. Hey, Brian.
Well, good morning. I'm sorry you called me eating breakfast.
Oh, that's all right. It's early in the morning. I understand, my friend. What's on your mind?
I may have to disagree with the English young gentleman from Vanderbilt. I don't think that we should keep, after the child's born, if it's found they definitely, was using, opioids or crack or something. I think they should separate them for a certain amount of time. And I tell you, I think this all goes back. I think the 90s was crack babies, and now it's opioid babies. The pharmaceutical industry never used to be able to advertise on TV, and all these pharmaceutical ads, I think they're bad news. They're just getting that whole industry has just bought Congress, and I think they need to slow that down.
Well, all right, let's talk about the first point he made in terms of, is there to some degree, I guess he was referring to what you said about how when it happens, you're trying to keep the baby with the mother in the hospital setting, which certainly in most cases you think, oh, that makes sense, keep the mother with the infant. But his concern, and a lot of people's are, this lady was doing these drugs, it seemed like she didn't care, and sometimes you wonder if that's not a full understanding of the addiction issue, but what about that? And are they monitored or separated for a period of time until the mother gets treatment?
Well, I think, one of the concerns is, what is the environment safe for the baby? And so one of the things that we do is we do report this to child welfare services. So it's their job to determine if that environment's safe. It's not my job.
That's right.
And so,
but if you do come across one that you were not aware of, and you see this child is very, very heavy in withdrawals, this mother's been doing drugs while she's pregnant, that's a DCS issue.
For illegal drug use, I'm required, the way we interpret some of the federal law, we report all of them to child welfare services. And it's child welfare, it's their job to determine what's safe.
If it was alcohol syndrome, would you?
Yes, and so there's a specific statute. It's called the Child Abuse Prevention and Treatment Act.
Gotcha.
But for a mom who was using methadone or buprenorphine, that's not necessarily true. That could be a mom who's been in recovery for years. And so one of the things that we see, again, if you have a fussy baby and you separate that baby from the mom, that withdrawal syndrome is going to get worse. And so that's what I'm talking about, the medical treatment. Oftentimes we find if we keep mom and baby together, we use less morphine to treat the baby, and that's an important piece. But there is a broader issue here. We need to have a safe plan of care for the baby. That's also our responsibility, but it's in that communication with child welfare.
Okay. When you do have the baby then, and maybe they're there with the mom and they're both going through some degree of withdrawal, what is the treatment then after the child's delivered? what are you giving the child to help deal with the stress of this, and same thing with the mom?
Well, so for the baby, we have a standardized score that we count how many physical signs that they have. So what that means is how fast are they breathing, how are they sleeping, how are they feeding, things like that.
Do you also pay attention to the baby? I'm sorry to interrupt.
No,
on that point, yeah, like when a child's born, or like I remember when my son was born, they're doing some basic things. They're snapping near the ear to see if the child. I get probably checking the hearing, and you know, trying to see if they feel if you squeeze something, or looking at the eyes, see if the eyes. Basic things like that. Are those part of the measurements with the child? I mean, in general, and you'll notice if they're going slower, or if it's abnormal in some way?
Well, so it's routine care, and then it's specialized monitoring for withdrawal.
All right.
If a baby is having withdrawal, we first treat them with the environment. We try to, again, imagine you're going through withdrawal, you're fussy, and we create a chaotic, loud environment. That's going to make it harder to go through withdrawal. So we first try to control the environment, but for babies who have severe withdrawal, we treat them with an opioid, a medicine like morphine or methadone, and we slowly taper that over a period of time to control their symptoms of withdrawal.
Like you would with an adult,
like you would with an adult.
Okay, and so that eases them through it, and then can you tell at what point you just observe their reaction that they don't need it anymore?
That's right, so we monitor them with the score.
How long does it typically take?
So the average length of hospital stay for a baby that requires a medication is around 23 days nationally that they stay in the hospital.
As opposed to a healthy child that's born is home sometimes these days.
24 to 48, 72 hours depending upon how they were delivered, vaginal delivery or C-section. So that's right. Wow,
okay, that we got to take a break. When we come back, more of your calls if you want to join us, 737-7587, but that sets us up exactly with the next point, you know, the cost of this.
Sure.
Wow. Think about that. From maybe a 2-day stay maximum with a healthy child to potentially 3 weeks plus with a child born addicted. We'll take a break and be back with more with the doctor right after this.
This is a